All right, so we're gonna do the bicep femoris, and then all the actions is the bicep femoris flexes the knee, laterally rotates the knee, and extends the hip. Neurological level is gonna be the sciatic tibia, and that's gonna be like L5, S1, S2, and 3, and then that's for the long head. For the short head, it's going to be the sciatic proneal branch, which is L5, S1, and S2. And then the bicep femoris originates on the ischial tuberosity, and for the long head, and for the short head, it originates off the linea aspera. And they insert on the head of the fibula. My patient's going to be prone. And my stabilization hand is going to be on her pelvis. My resistant hand is going to be on the posterior aspect of her distal lower leg. So the movement that's going to happen is she's going to flex her knee and externally rotate. So, and then compensations, it's going to be, she has her hips hiking up, is going to be the compensation. So her right side is affected and her left side is unaffected. So I'm going to start off. So first I'm going to say, can you externally rotate and then bring your heel to your bum, please. There you go. And then with my stabilization hand and my resistant hand, go. All right, relax. Same thing over here. Externally rotate, heel to bum. Good, and back down. Now do the same thing. And back down. So by doing that, because she can do it herself, it's going to be a grade 3. And with resistance, it's going to be a grade 5. Okay, so next we are going to manual muscle test the semitendinosus. And basically what this muscle does, it flexes the knee, medially rotates the flexed knee, and extends the hip. It also tilts the pelvis posteriorly. The neurological level of this muscle is going to be the sciatic tibia branch on L4, S1, S2. Your semitendinosus originates off the ischial tuberosity and inserts on the proximal medial shaft of the tibia at the pes serine tendon. My patient's going to be prone. My stabilization hand is going to be on her pelvis area, lower back, and my resistant hand is going to be on the posterior aspect of her distal leg. So movement that's going to happen is I'm going to internally rotate her foot, and she's going to flex her knee, bring it to her bum, and we're going to do that. She's going to do it by herself, and then I'm going to resist that motion. Compensation is, if she has a hiked pelvis, so we need to look out for that. If she can do it by herself, it's going to be a grade 3. She can do it with resistance, grade 5. Right side is affected, left side is uninjured. So we're going to internally rotate. She's also prone. I forgot to mention, I think. So bring your heel to your bum. There you go. And then left side, bring it up. Okay, and relax. Same thing, bring this one this way. And bring it up. There you go, and back down. Bring it up again. And back down, relax. All right. Okay, so next test we're gonna do is the gracilis. So basically what this muscle does, it flexes the knee and medially rotates the flexed knee and also extends the hip. Neurological level is the obturator L2, 3, and 4, and it originates off the inferior ramus of the pubis and inserts on the proximal medial shaft of the tibia. at the peasant serene. And then my patient's gonna be sitting on the table, and my stabilization hand is gonna be on the top of her knee, kind of like medial side of her knee. And my resistant hand is gonna be on the mid-foot of her, mid-foot. She's gonna start off in external rotation and internally rotate. If she can do that, that's a grade 3 by herself. And then with resistance, it's a grade 5. I'm also gonna test this bilaterally. Some compensations are gonna be her pushing against the table and then her hiking her hip up. All right, so now we're gonna get into testing the dorsals. So this is her affected knee, affected leg, and this was her unaffected. So we're gonna test it bilaterally. So we're gonna start off on this side. So she's gonna start off in external rotation, and then can you bring your foot in, please? All right, perfect. And then go out again, and bring it in. All right, because she can do that by herself. Do it by herself and with resistance, that's a grade 5. Any pain with that?
No.
And then same one, make sure my stabilization hand is here. Start off an external rotation and bring it in. Okay, and go back out. And bring it in. All right.